My name is Cynthia Alvarez, and I am a health studies major at Texas Women's University. The subject of health has always been a fascination of mine. I knew that I wanted to be in healthcare, I just didn't know in what capacity. I told myself that I wanted an acronym by my name as a representation of my accomplishments in healthcare. As far back as I can remember, studying health in grade school, high school, and eventually in college, it was always my strongest subject. It was as if it was second nature for me. From anatomy and physiology, learning about the bones and the function of the body, to fitness and health wellness, it was also thought-provoking. Personally, health education is a multifaceted area in which so many techniques and effective methods can be utilized for optimal health. I chose health studies because I have an inherent need to help others and to make a difference in the lives of people as well. As a registered dental assistant, I see directly how lack of knowledge affects one's complete health. Being unaware of how to properly maintain good dental health can also be a financial strain to so many. Dental work is expensive, but with adequate information, this doesn't have to be an issue. Throughout my career in dentistry, I've seen firsthand how periodontal disease and diabetes affects gum tissue, teeth, and overall dental health. Many are not aware of this and are not aware of the direct correlation between the two until it's too late. Early in my career, while volunteering in the Save a Smile program through JPS Hospital, I witnessed so many children needing extensive dental treatment. This was all due to improper nutrition, poor oral hygiene, bad habits, and ultimately lack of knowledge. Children as young as 7 years old had bleeding, swollen gums, and needed scaling and root planing. This is a deep cleaning below the gum line, removing plaque and calculus, and this procedure is painful. It's a painful procedure for most adults, and in most cases, the patient needs to be numb, and it requires more than just one visit. Seeing a young child needing this treatment was extremely heartbreaking. It's difficult to explain to a child that healthy gums aren't supposed to bleed, and it's even harder to explain to a parent when there's little interest in setting a good example. My goal is to work with women and children of every race and encourage healthy habits and effective oral hygiene instruction. I don't want to be a nutritionist or a dental hygienist, but rather an advocate to empower women and children with health promotion with their dental maintenance. Many studies have proved that when young mothers who gave their children fluoride, when their first deciduous teeth erupted, the likelihood of them developing cavities was reduced significantly. The education given to these same mothers increased and influenced their behaviors and attitudes towards dental maintenance. When routine care is available to ethnic mothers, the odds of children taking advantage of dental and preventative services like fluoride and sealants, it reduced inequalities related to race and oral health. I feel that if I bring awareness and proper education to this target group, the chances of periodontal disease and cavities will be lessened. I truly believe that this is where I found my calling. I would like to work in either the private or the public sector like WIC or Medicaid, educating women and children regardless of race. These two wonderful programs are centered around women and children and keeping them healthy, providing care that they would normally not be able to afford. Routine dental maintenance and good habits are imperative for a healthy smile. Healthy smiles build confidence. The mouth is an entryway to everyone's health, and tooth decay is a severe and growing problem. Looking back to my childhood, I remember seeing many of my family members put soda in bottles for their children to fall asleep with. At the time, it didn't seem out of the ordinary. It was only when these same children ended up needing silver crowns, extractions, and lots of fillings did anything really change. Finally, habits changed. Not only was this a dental risk, but also a nutritional risk as well. Caffeine robs the bones of calcium. Tooth decay is the most chronic condition that affects children in the United States. When left untreated, it can and will result in pain, infection, and even tooth loss. It can even impair speech development, swallowing, and chewing, causing self-esteem issues. I want to empower others with knowledge of how eating healthy, refraining from sugary foods, and proper dental care will keep their children from needing so much dental work in the future. Implementing a routine, including brushing, flossing, and regular checkups, will keep dental treatment at a minimum. Bridging the gap and being an advocate to others is what I want to do with this degree.